The Honourable Member for Elwick.
Thank you, Mr President. My question is number 83 for the Honourable Leader of Government. The financial burden for families seeking assessments for ADHD and other neurodevelopmental disabilities is significant for those earning a regular and substantial income, and for others with lower or less regular income is simply unaffordable. As at 27th of September, the wait time published on the Department of Health website for internally referred paediatric developmental behaviour appointments is 25 days for urgent cases, 480 days for semi-urgent cases, and 565 days for non-urgent cases. These significant delays impact on a child's ability to successfully engage in education and develop pro-social skills. My questions are: 1, what are the criteria for determining whether an appointment is urgent, semi-urgent or non-urgent? 2, what is the wait time for externally referred paediatric developmental behaviour clinic appointments? And 3, what action is the government taking to make diagnosis of ADHD and other neurodevelopmental disabilities more accessible?
The Honourable Leader.
Thank you, Mr President. Thank the Honourable Member for her question. So the answer to question 1 is: a patient is allocated an appointment category based on the urgency of the condition from the information provided in the referral. The 3 categories are as following. Category 1, which is urgent, so an appointment within 30 days is desirable, and condition will require more complex or emergency care if assessment is delayed, and condition will have a significant impact on quality of life if care is delayed beyond 30 days. So category 2, which is semi-urgent, so the appointment within 90 days is desirable, and condition has the potential to require more complex care if assessment is delayed, and condition has the potential to have some impact on quality of life if care is delayed beyond the 90 days. Category 3, which is non-urgent, an appointment within 365 days is desirable, a condition is unlikely to deteriorate quickly, and condition is unlikely to require more complex care if assessment is delayed beyond 365 days. So the development and behavioural concerns, including the ADHD assessment, are generally not prioritised as Category 1. Category 1 patients are patients with life-threatening and time-critical conditions. Question 2, the current average time on the neurodevelopmental waiting list is 406 days. Question 3, the Tasmanian Government is absolutely committed to making it easier for people with attention deficit hyperactivity disorder to get the right care in the right place at the right time. We continue to progress our election commitment for a new GP specialist service for children with ADHD to ensure families can access a GP with a special interest sooner, with $2.5 million committed in the recent budget to progress this important service. Planning work is also underway to develop the ADHD clinic run jointly between Paediatrics and the Child and Adolescent Mental Health Service, that's CAMHS. This would be a dedicated ADHD service combining resources of our neurodevelopmental clinic and staffing from CAMHS to run a truly multidisciplinary ADHD clinic with a priority on improving access. This clinic could incorporate additional GPs. So kids care clinics have been set up over the past 2 years and see vulnerable children with neurodevelopmental concerns and conduct both ADHD and autism assessments. And that's the finish. Thank you, Mr President.